I'd like to talk about the management of hair loss in the crown. It is a common area that patients come seeking a hair restoration procedure. And I like to explain to patients that they understand that the crown is more difficult to fill in a single procedure. So for example, if I place in a single bald area, one that's up front versus one that's in the crown, if I place 1,000 grafts, let's say 2,500 hairs in each area, the results in the frontal region will be 60 to 70% filling in. Meanwhile, in that same size area with the same number of hairs, the results in the crown will only be a 30, 40, maybe 45% filling in. There's a lot of reasons for this. First of all, the crown is a convex surface as opposed to frontal region, which is flatter. Plus in the crown, the hairs grow in a radial fashion. So I always like patients to understand that the number of grafts required to fill in a given area in the crown is going to be significantly higher than that would be required to fill in a frontal area. Another thing about the crown is that it gets bigger, potentially. Now, of course, medical therapy may prevent that from progressing. However, in the majority of men, the crown area is going to continue to get larger due to the progression of hair loss. And understand that once the crown area is filled in, let's say an area this big, and then it doubles in size, you need more than twice as many additional hairs to keep up with that continued thinning or continued hair loss. So I always advise patients we need to evaluate total donor hair supply, find out what their goals are. I always like to focus, if possible, on the frontal and or mid-scalp region, but if patients do want crown coverage, I will discuss the pros and cons and determine a good graft count. Another area of developing techniques where we can use or help with the crown is with the use of body hair, such as beard hair and or chest hair. While those hairs may not be ideal for the frontal hairline, they can provide some coverage in the crown region. So we're big advocates of what's called BHT or body hair transplants. We're using these body hairs to go ahead and fill in the crown. Anyway, this is Dr. Epstein. I just wanted to explain the difference between working on the frontal region versus a real comprehension of what it means to transplant a crown region.